1 in 10 people in this world have diabetes, but if asked what is actually taking place in their body, very few can explain that. Allow me to explain this in just 3 minutes. So imagine there's a city, and the city has buildings, and those buildings each needs electricity, and so is your body, which has organs such as the heart, the brain, the lungs, and other organs which need energy, and that is glucose, which is sugar you get from the food you eat. Now that glucose or sugar from the food you eat can't just get into the cells of your organs. They need a key, and that key is insulin from the pancreas. Normally when you eat food, now that glucose enters your blood, and your pancreas produces insulin. The insulin unlocks your cells, and then glucose goes in. The cells use that glucose to produce energy you need for your day-to-day activities. Diabetes is what happens when that system breaks down. So it's either the pancreas does not produce enough insulin to unlock the cells so that glucose goes in, produce energy, or enough insulin is being produced by the pancreas, but it is not unlocking those cells. So since the glucose is not being used by the cells, it keeps up building up in blood, and with time destroys organs in the body, like the blood vessels, like the heart, like the eyes, like the kidney, and very many others. There are 3 main types of diabetes, and one of them is type 1 diabetes. In this type, you take it as if your body is standing against itself. The immune system that is supposed to protect your body starts destroying the cells of the pancreas, and now the pancreas cannot produce any insulin. And people with this type have to have insulin injections each day. So this kind of diabetes does not depend on diet or lifestyle. The next type is type 2 diabetes, and this is the most common type, whereby in every 10 diabetic patients, at least 9 have type 2 diabetes. So what happens in this type? This type, the pancreas produces enough insulin, but some of that insulin does not unlock your cells to take in glucose. And so the pancreas keeps on producing more and more insulin until it cannot produce any more. It gets exhausted and stops producing it. The next major type of diabetes is gestational diabetes. This one occurs in pregnancy, where the body becomes insensitive or resistant to insulin due to hormonal changes. This one usually goes out after delivery, and it increases the risk of having type 2 diabetes. So how do you tell that you have diabetes? And one of the key signs of diabetes is excessive urination. Now, your kidneys try as much as possible to flush out that excessive sugar in blood, so you end up urinating a lot. And now, since you're urinating a lot, you have a lot of thirst. So you find a person has a lot of thirst or feels a lot of thirst or rise. And then you also have body weakness, or you don't have energy, or you feel tired, because the cells are supposed to get glucose, which they aren't getting. Now also, since your body is not having glucose, or since your body cells are not getting glucose to produce energy, your body decides to break down other alternative sources of energy like fat, muscles, and so you find that person, he loses a lot of weight. So you will find that people with diabetes also have poor wound healing, or their wounds take long to heal. Why? Glucose destroys blood vessels, and those blood vessels transport healing cells. So that means the blood vessels won't be able to transport healing cells towards that wound, and that wound will take long to heal. Before I go, people usually think sugar entirely causes diabetes, but this is not true, because type 1 diabetes is entirely autoimmune. It doesn't have anything to do with the sugar. Gestational diabetes is more of hormonal changes in the ladies or pregnant woman's body. And then type 2 diabetes is the one that is more inclined to lifestyle and diet. Thank you very much for listening. Please like, follow, share, and comment.